Hi, my name is Dr. Nikki Green. I practice on the west side of Fort Worth, Texas. I have a clinical tip today for the thriving dentist community. So this is a clinical tip that was actually given to me years ago when I was a younger dentist working on my efficiencies in dentistry, and I had a more experienced dental assistant who gave me the advice that if I would do my clinical dentistry in the same order every time, I would get a better result from my dental assistant. And man, was she wise in giving me that tip. So I want to go into a little bit of depth of what I mean by that. So if you're working on your own clinical efficiency, you're working on your relationship with your dental assistant, and your goal is to create an efficiency that your patients even remark about. So an example of that is I love it when at the end of a procedure, my patients remark with, man, you guys are a well-oiled machine, or man, you guys really work well together. Man, y'all don't hardly even communicate, but yet you seem to be exactly on the same page. That's the kind of clinical efficiency that I'm looking for. So again, I have to give credit to a dental assistant, Ashley, who gave me this advice, but the piece of advice was make sure you're always doing your clinical steps in exactly the same order. So let me give you an example. Doing a filling, my clinical steps are, obviously when I'm doing the filling, the clinical steps might include matrix bands, your etch and bond steps. I'm not actually going into depth about those. It's more about what I do after I'm done filling. So after I'm done doing an occlusal or a class 2 composite, posterior composite, I always do things in this order. Remove all the matrices, carve my anatomy, remove the bulk of excess flash. Then I start checking occlusion. I keep checking occlusion until I've got occlusion exactly where I want it. Then I come back and do my fine polishing and removing of the fine excess flash. I always ask for a scaler so that I can scale in between the teeth, make sure I remove any flash of bonding agent, that type of thing. And then the very last thing I do is check floss. Even on a class 1 composite, I want to check floss to make sure I don't have any bonding agent in between the teeth that might prevent the patient from being able to floss when they get home. So I always do things in that order. Prior to being given that piece of advice, sometimes I would check interproximal contacts, remove flash, then check occlusion. The next time I might check occlusion first. All of that just creates, inconsistencies between you and your dental assistant and slows you down and makes each of your jobs harder. So just always do things in the same order. Comes to a crown seat. I always, take off the temporary, clean off excess cement, address the tissue. If I've got bleeding tissue, I want to get that under control before I ever start putting the restoration in the mouth. Put the restoration in the mouth. I always check margins, check contacts, and only then do I check occlusion. And then even after all 3 of those steps, only then do I do a pre-cementation x-ray. So those are just a couple of very basic dentistry tips that have definitely contributed to my efficiency in my practice and definitely contributed to the relationship between me and my dental assistant and taking that relationship to one that even patients remark about. So, consider it a simple one, but I think it's an important one. Clinical tip of just making sure you're always doing things in the same order each and every time to make things more predictable and better for working smarter, not harder for you and your dental assistant. Hope this helps, and happy Monday to the thriving dentist community.